There's a moment many men experience and never talk about. It happens quietly. One night things don't respond the way they used to. Maybe it's stress, maybe it's fatigue, maybe it's just one of those days, so you dismiss it. But then it happens again. Not dramatically, not completely, just differently. Slightly slower, slightly weaker, less predictable. And instead of asking why, most men blame age. But what if it's not just aging? What if it's an early signal, not of weakness, but of circulation? Erectile function is a blood flow event. An erection is not just desire, it is a vascular process. It requires healthy arteries, flexible blood vessels, proper nerve signaling, balanced hormones, a calm nervous system. When any one of these shifts, function changes. The penis contains small arteries, much smaller than the arteries in the heart, which means something important. If blood flow is slightly restricted, it will show up here first. Before chest pain. Before heart symptoms, before major warning signs, sexual performance can become the earliest indicator of vascular change. Why this happens? After 45. After midlife, arteries naturally lose some elasticity. Plaque accumulation may begin silently. Blood pressure fluctuates more easily. Nitric oxide production decreases. Nitric oxide is the molecule that relaxes blood vessels and allows blood to flow efficiently. Lower nitric oxide means reduced expansion. Reduced expansion means reduced firmness. This is not psychological weakness. It's vascular physics. The role of inflammation. Low-grade inflammation damages the inner lining of blood vessels. That lining, the endothelium, controls dilation. When inflamed, it stiffens. When stiff, it resists expansion. The result is reduced blood flow response. This is why erectile dysfunction and cardiovascular disease often share the same root cause. The penis doesn't fail randomly. It reports early. The stress connection. Stress activates the sympathetic nervous system. Fight or flight. Adrenaline rises. Blood vessels constrict. Heart rate increases. An erection requires the opposite state. Rest and relaxation. Parasympathetic activation. When stress becomes chronic, the body stays in guarded mode, even in intimate moments. The brain may want connection. The body may be bracing. The performance. Anxiety cycle. One inconsistent experience can trigger doubt. Doubt increases stress. Stress increases adrenaline. Adrenaline reduces blood flow. The next attempt becomes harder. Now fear enters the equation. Fear tightens muscles. Tension reduces relaxation. Relaxation is required for blood flow. The cycle reinforces itself. What began as a vascular fluctuation becomes psychological reinforcement. Testosterone's supporting role. Testosterone does not directly cause erections, but it supports the environment required for them. It maintains libido, supports nitric oxide pathways, influences mood and confidence. When testosterone declines gradually, desire decreases. Reduced desire reduces arousal. Reduced arousal reduces blood flow signaling. The body follows the signal it receives. Metabolic health and sexual function. High blood sugar damages blood vessels. Insulin resistance impairs endothelial function. Excess abdominal fat increases inflammatory compounds. These metabolic shifts affect the smallest arteries first, which is why erectile changes can precede diabetes diagnosis by years. Sexual health becomes a metabolic mirror. Medications that influence performance. Common prescriptions can affect blood flow, nerve signaling, hormone levels, libido, blood pressure medications, antidepressants, anti-anxiety drugs, Sometimes the solution is not adding medication, but adjusting what's already there. This requires conversation, not silence. Why many men wait too long? Embarrassment delays evaluation. Denial delays action. And many men assume decline is inevitable, but early erectile dysfunction is often reversible when underlying factors are addressed early. Waiting allows vascular damage to progress. Listening early preserves options. What improves vascular sexual health? The same actions that protect the heart protect erectile function. Resistance training, moderate cardiovascular exercise, blood sugar control, reduced processed foods, smoking cessation, alcohol moderation, adequate sleep stress regulation. These improve endothelial function. Improved endothelial function improves reliability. The emotional weight. Sexual function is deeply tied to identity. When reliability shifts, confidence shifts. Men withdraw. They avoid intimacy. They internalize failure. But the body is not issuing judgment. It's issuing data. And data can be addressed. The bigger picture. Erectile dysfunction is not only about performance. It can be the body's earliest cardiovascular warning sign. It can signal arterial stiffness, blood sugar imbalance, inflammation, hormonal shifts, stress overload. When treated as a symptom rather than a shame, it becomes valuable information. What happens? When root causes are addressed, men often report improved firmness, faster response, increased desire, better stamina, stronger morning erections, greater confidence. Not because youth returned, but because circulation improved. This is not about perfection. Aging changes the body, but persistent dysfunction is not simply the price of getting older. It is often the price of unaddressed vascular and metabolic strain. When that strain decreases, function often improves. Final reflection. If performance has changed, don't panic, but don't ignore it. The body whispers before it shouts. Sexual health is not separate from heart health. It is connected, and when you protect your circulation, you protect far more than intimacy. You protect longevity. Your body is not failing you. It may be warning you early, and early signals are powerful. There is a moment most men never talk about. It doesn't arrive with sirens. It doesn't feel dramatic. It begins quietly. A slower morning. A body that once responded instantly now hesitates. Desire that used to rise like instinct now feels unpredictable. And in that silence, a question forms. Not about performance, but about identity. What is happening to me? Sexual health is rarely just about the body. It is deeply wired into confidence, mood, motivation, even the way a man walks into a room. When changes begin, many assume it is simply aging, but the truth is more layered, more biological, and far more controllable than most people realize. Inside the male body, a complex hormonal orchestra plays continuously. Testosterone, often simplified as the male hormone, is only one instrument. It works alongside luteinizing hormone, follicle-stimulating hormone, cortisol, insulin, thyroid hormones, dopamine pathways, and nitric oxide signaling. When these systems are balanced, sexual function feels effortless. When even one shifts, the effects ripple outward. After the age of 30, testosterone levels decline gradually, about 1% per year on average. That may sound small, but over a decade, that becomes a noticeable drop. Lower testosterone can influence libido, energy, muscle mass, fat distribution, mood stability, and erectile function. Yet hormones are only one piece of the puzzle. Erections are not driven by desire alone. They are vascular events. Blood flow must increase rapidly into the penile corpora cavernosa, two sponge-like chambers that expand under pressure. This requires healthy arteries, responsive endothelial cells, and sufficient nitric oxide release. Nitric oxide relaxes smooth muscle tissue, allowing blood vessels to dilate. If blood vessels are stiff, inflamed, or narrowed due to high blood pressure, smoking, diabetes, or elevated cholesterol, the signal weakens. In fact, erectile difficulties can sometimes be an early warning sign of cardiovascular disease. The penile arteries are smaller than coronary arteries. If plaque begins forming, symptoms may appear there first. It is not just a sexual issue. It can be a vascular one. Metabolic health also plays a powerful role. Excess visceral fat increases aromatase activity, an enzyme that converts testosterone into estrogen. As body fat rises, testosterone can decline further, creating a hormonal feedback loop. Insulin resistance reduces nitric oxide availability. Chronic inflammation disrupts endothelial function. What appears to be a bedroom problem often begins in the bloodstream. Then there is the brain. Sexual response begins in neural circuits involving dopamine, serotonin, oxytocin, and the limbic system. Chronic stress elevates cortisol. High cortisol suppresses testosterone production and dampens libido. Poor sleep reduces nocturnal testosterone peaks, which typically occur during REM cycles. Sleep apnea, common in men over 40, can significantly reduce hormonal balance and oxygenation. Even psychological factors cannot be separated from physiology. Performance anxiety activates the sympathetic nervous system, the fight or flight response, but erections require parasympathetic dominance, the rest and digest state. Anxiety literally shifts the body into a mode that prevents optimal blood flow. And yet, despite this complexity, many men suffer in silence. They may experiment with quick fixes without addressing root causes. But sustainable sexual vitality is rarely about a single pill or supplement. It is about restoring systemic health. Regular resistance training stimulates testosterone production and improves insulin sensitivity. High-intensity interval training enhances vascular flexibility. Adequate protein intake supports hormone synthesis. Zinc, magnesium, and vitamin D play roles in endocrine balance. Omega-3 fatty acids reduce vascular inflammation. Sleep is not optional. 7 to 9 hours supports hormonal regulation and cognitive clarity. Managing stress through controlled breathing, meditation, or therapy reduces cortisol burden. Limiting alcohol protects liver metabolism and testosterone conversion. Avoiding smoking preserves endothelial function. For some men, medical evaluation is necessary. Blood tests measuring total testosterone, free testosterone, SHBG, prolactin, thyroid hormones, fasting glucose, lipid profile, and inflammatory markers can reveal underlying imbalances. In certain cases, medically supervised hormone replacement therapy may be considered, but it must be guided by qualified healthcare professionals, not self-prescribed trends. Sexual health is not vanity. It is a biomarker. It reflects cardiovascular integrity, metabolic efficiency, neurological resilience, hormonal harmony, and psychological stability. When sexual function declines, it can be an invitation to examine overall health more deeply. But beyond biology, there is something equally important: communication. Relationships can suffer when silence grows. Partners may misinterpret distance as disinterest. Honest conversation reduces pressure and restores emotional connection. Intimacy is multidimensional: touch, trust, vulnerability, presence. Performance is only one component. The narrative that male vitality simply fades without recourse is incomplete. While aging is inevitable, decline is not entirely passive. Lifestyle, awareness, medical guidance, and emotional openness can reshape the trajectory. The body does not betray without reason. It signals. It whispers before it shouts. And when a man chooses to listen, not with fear, but with curiosity, change becomes possible. Sexual health is not about proving youth. It is about preserving function, confidence, and well-being across decades. It is about understanding that the systems inside the body are interconnected, and caring for one strengthens them all. Energy can return, confidence can rebuild, intimacy can evolve rather than disappear. Because vitality is not a single moment in youth, it is a lifelong conversation between biology, behavior, and belief. And that conversation is still in your hands. Your body is not failing you. It may be warning you. Early, and early signals are powerful.